So in this module, we're going to have a look at our secondary or top to toe survey. Remember, I'm only going to consider my secondary survey if I am 100% satisfied that my casualty is breathing. If I'm not, then I'm already doing CPR whilst awaiting an ambulance. So I've checked the danger, I've ascertained that my casualty is not responding to me, I've opened the airway, I've checked the breathing for 10 seconds, I'm satisfied with the breathing. Now what I have the option to do is a top to toe survey, and it's just that. This is a very quick look as a first aider from the casualty's head to the casualty's legs. All I'm looking for are obvious clues, signs, anything that I might be able to hand over to the emergency services that might be able to improve the secondary care that they give. So preferably with a gloved hand, I want to have a very, very gentle look and feel with the back of my hands around the casualty's head. Now what I'm looking for are any obvious indentations. How does the area feel? How does the area look? Is there any blood? Are there any bodily fluids? I want to make my way down to the casualty's eyes. I want to very, very gently, if I can, just open the casualty's eyelids and have a look at the eyes themselves. Are the eyes very dilated? Are they very fixated? Is one very dilated and the other is very narrow? That could be an indication of a severe head/brain injury. I want to have a look at the casualty's ears. Is there any blood? Is there any bodily fluids? Straw, sickly coloured fluid making its way out of the ears. Again, could indicate damage to the spinal cord, base of the spine, or again, the brain itself. I want to have a look at the casualty's nose. Is there a sign of a physical attack there? Do I believe that they've been assaulted? I could have a look for evidence of drug use. Anything that might be useful to the services when they arrive. The casualty's general complexion, if they're very pale, if the lips are blue, perhaps they're very cold to the touch. This could be an indicator of internal bleeding, or it may indicate that the casualty has been there for some time, hence the gravity has slowly drawn the blood away from the cervix and towards the bottom of the casualty. I now want to have a look around the patient's throat, the patient's neck. Again, are there any signs of trauma or struggle, handprint, physical injury? Is there a ligature? Was this a potential self-harm? I'm just looking for clues as to what may have happened here. As I make my way down my casualty's torso, again around the chest area, around the stomach area, I'm looking for decolorization, bruises, burn marks, scratches, bleeds, sign of a trauma. There may be a particular area around the liver, kidneys, around the lower abdomen and stomach area that's a notably different colour to the rest of that area. So I might be looking for an area that's purple, red, blue, slightly bloated. This may be an indication that there is an internal bleed. And a fantastic way that we can check for internal bleeding is to very gently lay the back of your gloved hand on the area that's a different colour. Hold it in place for a few seconds. Now when you move your hand, your handprint is going to stay there. This is very similar to what we call the capillary test. If you were to pinch the end of your fingernail, you'll note that it goes pale. We're pushing the blood away from the surface. But when we remove it, the surface draws the blood back to it and the colour comes back. If blood is collecting, it's pooling in a certain area, it's not circulating. So your handprint is going to stay there. Now having a look down the casualty's arms, the casualty's legs, again a very, very gentle feel. How do they look? How do they feel? Do they look like they're awkward? Do the bones look like they should do? Are they in a slightly strange angle? I'm having a look for swelling, again signs of fluid, trauma, struggle, blood, anything that doesn't look right. Remember of course that your operator will talk you through the secondary survey, things that you can look out for.